Hello, my name is Fathi Elloumi. I'm a staff scientist at the National Cancer Institute in the Developmental Therapeutic branch. Today, I present TumorMiner, a new tool for precision medicine. TumorMiner is an interactive, easy-to-use tool dedicated to physicians and scientists without bioinformatics background. As a user, you can query patient data. For instance, you can search for a specific patient based on patient ID or different criteria such as demographic, disease, data sources, genomic experiment, and treatment availability. You can display patient main clinical, molecular feature, non-biomarkers, or potential immune therapies. You can also search for similar patient to your patient sample and look for treatment options. TumorMiner enables to do cross-patient analysis. You can perform multivariate survival analysis. You can look for association between genomic feature and signature across different patients. And finally, you can construct and assess multivariate linear predictive model. We started collecting data from our branch physician at the National Cancer Institute, and we extended to other internal institutions and external collaborators from different universities. We did upload few datasets from TCGA. So far, we collected data from 694 patients with different cancer types. The most representative cancer are the small cell lung cancer with 32%, adrenal cortical carcinoma with 22%, pheochrocytoma with 21%, gastrointestinal neuroendocrine tumor with 8%, pancreatic neuroendocrine tumor 6%, and paraganglioma 4%. TumorMiner hosts genomic and clinical data. Genomic data include RNA-seq with normalized gene expression after we remove the batch effect. All exome sequencing data, we focus on only somatic variant, and we generated gene mutation value. We have also DNA methylation. We computed methylation gene level summaries and generated copy number data from methylation. We also incorporate genomic signature such as neuroendocrine replication stress and other known signature. For clinical data, we have demographic patient information, we have sample information, and also we include survival information and treatment response. Now we switch to TumorMiner interface and few use cases. Here is TumorMiner interface. The main menu options are My Patient, Survival Analysis, Cross-Patient Analysis, Metadata Information, Search IDs. This is a search for the feature, different feature, and the help section. By default, the patient table is displayed and the user can search for a specific patient by entering the patient ID or browsing the table or looking at the top of the column on the search box to select the patient according to some criteria, such as, for example, it could be gender, the age, it could be the disease, or the test set, or number of sample. Once you select the patient, you have access to his clinical and genomic data, and you can look at the top on the patient menu to select see the clinical information or go over the genomic, gene expression, for example, or mutation. And also we can look at the potential therapy for this patient. Here an example of patient gene expression. Patient CL270 have two RNA-seq samples, CL270T1 and RT088. We display the top expressed protein coding genes sorted by the mean of the two samples. We have other option for visualization and for filtering on the left panel. In TumorMiner, we suggest possible immune therapy treatment. For patient CL270, the selected antibody drug conjugate treatments are based on target genes having minimum value of 6 in one of the samples. TumorMiner allows to compare a patient sample to all patient sample or cell lines based on genomic and clinical profile similarity scores. Genomic scores include a maximum of 3 scores. or expression, mutation, or methylation, and they are computed using Pearson correlation. Clinical scores or clinical profile scores are based on patient and sample information, and they are computed using Jacquard matrix or common feature. Here we display a table or balloon plot with the top 22 tumor samples that are similar to the sample CL270_T1. Similarity was computed based on the sample CL270T1 top 1000 highest and bottom 1000 lowest genes in expression and mutation. By default, the results are sorted by the mean of the genomic scores, and the scores are represented by circles, and the larger the circle, better the score. Other similarity criteria options are available on the left panel. I will finish my presentation today with an example of overall survival analysis showing Kaplan-Meier plot, risk table, and Cox result for PINK1 in TCGA-ACC. The user had the option to run lasso without entering any gene predictor, or switch to survival based on mutation or metadata. I would like to thank all members of TumorMiner for their contribution to this work, and especially Dr. Yves Pommier for his guidance, expertise, and support. Thank you for your attention.